Live breaking news from your local news channel.
Well, thank you for joining us for this News Channel special report. I'm CJ Ward. California Public Health is holding a last-minute news conference right now. It comes on the heels of a major announcement from Governor Newsom. All counties in the most restrictive purple tier of the state's reopening plan will have an evening curfew starting on Saturday. Let's listen in live.
How we got here and really what the path forward is to make sure that we keep our public health in mind, we support one another, and we come together as we have before. So, as always, just want to begin and give you a bit of the national context. Sadly, we have day over day broken new milestones, whether it's in cases, hospitalizations, or sadly deaths across the nation. The Midwest in particular has been heavily hit, but really no region of of the nation has been spared. That the wave of cases that have been happening over weeks now have turned into record high hospitalizations and intensive care unit stays, that a number of states are making difficult decisions about how to allocate care. And even though we have the hope of vaccine and the discussions about what lies ahead on that front, we have to take care of the urgency of the day. And in California, as we've enjoyed lower rates of transmission, lower numbers of cases, we too are seeing this surge growing faster and faster, and we must address it immediately. So today's numbers, although not our highest number ever, frankly, on this sort of surge that we've been dealing with, this is our highest number to date. 11,478 COVID cases reported, widespread across the state, moving our 7-day average to 9,665. This is in the face of, frankly, what is a lower than recent numbers of tests reported. We had been reporting upwards of 200,000 tests across the state. This is in the face of lab efforts built by the state. We talked to you about our partnership with PerkinElmer, but really so many different health systems, so many different laboratory partners have really stepped up in California to provide lab testing and COVID testing so we can be informed about diagnosis, track the disease, and put our contact tracing and efforts around supporting isolation when necessary and quarantine at other times so that we can stem the tide. The governor often focuses on test positivity, accurately so. We have seen this number come up from what had been below 3% just weeks ago to now a 14-day positivity of 5% and a 7-day positivity concerning up to 5.6%. We have a goal to keep this as low as possible, to continue to test our communities, to find cases, to wrap around those cases, avoid one case becoming many. But this number is one of caution and one that intensifies our resolve to get it back under control. If you take a closer look at this 7-day positive, 14-day positivity, we knew just a couple weeks ago we were at 3.3%. We were talking to you then about how it's climbing and it's rising, and it certainly has a nearly 52% increase just over the past 2 weeks. I know the numbers, it feels like, it's just a small difference between 3.3 to 5, but it's a very significant difference in the percentage increase, which is when we focus on not just increases in rates, but this notion of rate of rise in 2 weeks to have a 52% increase is quite concerning to us across the state. Hospitals, we talk to you about hospitals all the time, that we know that 12% of today's cases will be hospitalized in 2 to 3 weeks. That helps put these numbers in context. We've seen a 63.6% increase in hospitalizations for COVID-19 over the past 14 days. Just days ago, reporting that we were just climbing over 3,000 cases in the hospital across the state. Today, over 4,500. Our ICU capacity, one of our most precious resources, that signifies not just the bed in a specialized unit, but specialized staff trained to use the equipment and take care of very sick individuals, and ventilators and all the medications and tools that help us support one's respiratory system. Those beds, have seen an increase of 40.5% over the last 14 days and have climbed to just over 1,100 individuals in those beds. Just a reminder that if we look day over day, week over week, we've seen a climb, not just in the number of individuals who are hospitalized, but really in the number of new admissions coming through the front doors of emergency rooms and hospitals across the state, something that is concerning. So even though that number slowly rises on hospitals, much faster are the number of new admissions, because what I said earlier, a reminder, roughly 12% of those individuals, those cases today that test positive, we expect will be in our hospitals in 2 to 3 weeks. So we've talked about not just the rise, but the steep rise, that rate of rise. You look at what we experienced during that first significant surge early on in the sort of the middle of the summer in June and July. We had a peak rate of increase of about 39.2% over a 7-day period. Again, here we're over 50% in the same 7-day period. This doesn't necessarily tell us where we'll end. Some states across the nation have seen this double in just a week. We know that we are still increasing that rate, and we aren't sure where the peak will be. So that is why we certainly need to be laser focused on all things we can do collectively across the state. Just take a look at a couple of important counties. We have 58 in California. We chose 2. Los Angeles County, we're often talking about how Los Angeles County really does drive transmission across the state. We see them a very important populous county, just at the beginning of the month, reporting 1,500 cases a day. A few days, a week before that, they were hovering about 1,000, 1,100. Today, 147% increase since then at 3,742 cases. And certainly all signs point to continued rise in that number and potentially even higher numbers than this report today. Madera County, sure, smaller county versus LA, geographically separated, but still 6 cases on November 1. Today reporting 34 cases. You may say, well, that's still a small number, but that rate of increase, 460% over a small 2.5-week period, is an important message to all of us that this can go very quickly. The support from Madera County is important. All counties getting the support that they need so that we can curb this transmission and ensure that our hospitals are prepared for those who need it the most. So what has caused the rise to go so high and so fast? And I'm often asked this question. I've been asked on Zooms and press conferences before, well, you say it is this, but where's the evidence? You say it's that. And we do have plenty of data and evidence around certain sectors. But overall, I will say that there is no single culprit. It's a combination of factors. It's certainly the colder weather, more mixing, which comes with more opening, not just of places indoors and places where you can mask, but places that are indoors that don't have an easy time masking the whole time. And of course, greater travel. We've enjoyed some events over the last many weeks in my home county of Los Angeles, the Dodgers, the Lakers. We had Halloween. We just exited Veterans Day. We're looking forward to other future events and activities as we go into the winter. We've had some things to celebrate, some things to protest, coming together in ways that we don't usually always do. All of those things create opportunities for the virus to spread, opportunities where when we put our guard down, it certainly does spread. And we know that those are factors driving this high transmission. So what does it mean when levels are this high across the state? Really means that activities that you normally do are higher risk today than they were a month ago. We've seen reports of people saying, well, I haven't changed my behavior. I was doing the same thing a month ago. Well, today, because the background transmission rate, the level of COVID in our communities is higher, even our everyday activities become higher risk. And we must be resolved to put up our protective guards even more than we usually do. And so today's collective actions that I'll be discussing in just a minute target activities that are particularly high risk while minimizing the disruptions and the social connections we all need and desire. So our ability to be more targeted and thoughtful is an important part of our overall message and approach. So a reminder, I've used this slide many times before about what some of those high-risk activities are. We said and talked about the need to mask, and not just mask for part of the time, but the whole time. We know that when you're eating and drinking, the mask comes off. We ask you to keep it off as short a time as possible, to put it back on when you're done eating, when you're done drinking, even if you're getting together 6 feet apart from friends and others you haven't seen outdoors, that keeping that mask on is an important strategy to reduce risk. Activities when you're seeing people that you haven't seen in quite some time, people outside of your household. This includes close family members, friends who haven't been with you in some time, that just because you know them well on a personal level doesn't necessarily mean that they in any way wouldn't be able to transmit the virus to you or you to them. Activities where it's difficult to keep your distance. I often think about playing board games and card games with my kids on the carpet of our living room, or employees in a break room. We've heard about outbreaks at hospitals, not in a patient's room, not the ICU or emergency room. Certainly that happens too, but often when staff take their guard down, they think it's a moment of rest, and yes, we all need it, especially under these difficult conditions, but that isn't a time to take off your mask, enjoy your meal. It's time to keep it up and make sure we do what we can to prevent the spread. Activities that are longer duration, we know that the longer your potential exposure is, the more likely you are to either be infected or spread the infection to someone else. And activities that don't allow plenty of fresh air to circulate. We've learned a lot in the past couple of months. Probably one of the most important areas of development with COVID is our understanding of the criticality of ventilation. Getting fresh air into rooms is really key. Having that air circulate frequently over the course of time, each hour, many air circulations, as many as we can achieve, really do reduce the risk. And those settings where that's not possible are indeed high risk for all of us. As I was trying to explain this to my own mother here in California, I was thinking about a simple way and almost an equation to understand how we can calculate your risk for COVID, and really came up with this in that discussion, that your chance of being infected is sort of this simple equation. On the top, the likelihood of an exposure, as that goes up because there's more baseline background virus in our communities, that you're in a situation, the duration of exposure going up, that's sort of complementing, they're additive. As that goes up, our chance of getting infected certainly goes up, but it's always divided by or reduced by the level of protection that we have, our ability to keep our mask on, our own personal discipline to keep that mask on, not just when you're with those who you're not familiar with, but sometimes especially those when you're with those who you're familiar with. We know more and more the role of household transmission. What I mean by that isn't when you're gathering with people in your house. It's actually when you maybe return from work or school and you are been mixing with folks where you might have been infected, that being able to protect especially those vulnerable people in your home by wearing your mask, an important issue. And then, of course, keeping that separation, that physical distance of at least 6 feet helps reduce this overall risk. So something that was effective with my own mom, wanted to share it with you today as you think about how we are in the situation that we're in California, that certainly that increased exposure is key. Our urging to limit your exposure helps reduce that overall risk, but then really amping up and elevating our level of protection through the protective factors and different interventions we've been talking about, both the governor and I, local public health, national public health leaders, for many, many months now. So to the announcement today of what we'll be doing in the state of California, we are going to, just as we did back in March, we started with a full stay-at-home order. It was very effective. Californians came together. We were able to stay ahead of our curve and keep transmission low. Today, in a more focused way, based on many things that we've learned over the past many months, I'll go over those things in just a moment. We are putting forward a limited stay-at-home order, one that is more targeted, one that is more focused in the following ways. It impacts counties that are in the purple tier. You'll remember on Monday, we announced 41 counties across California are in the purple tier. Today, we are not announcing additional counties in the purple tier. In fact, over the past 48 hours, as we looked at the data, no county across California has moved to a more restrictive tier, and certainly no one has moved to a less restrictive tier. We're asking that as part of this targeted, limited stay-at-home order, that people are home by 10 and stay home until 5 a.m. This means that many essential businesses that we've in the past called non-essential businesses. There's a list of what's included and not included in that category, that we ask that they close operations by 10 p.m., that people can get home by then, and that they stay home, and those businesses don't resume operations till at least 5 a.m. throughout all of the purple counties. This order, this public health order that will be modified at the state level, will be effective November 21st, so that's Saturday night at 10 p.m., and will go until December 21st at 5 a.m. So what does this mean practically? I'm sure many are asking what this means. I just wanted to highlight a few things at the top. I know I'll get many questions on this and look forward to answering those. But what does it mean that you can still do? So I think about my own life and often the need with 4 young kids to make a late grocery store run to make sure we're stocked for breakfast in the morning or a meal. And yes, it does mean that I could still go to the grocery store at 11 if that grocery store is still open to pick up milk or eggs or whatever I need. My dog doesn't walk very well, hard to get around the block. But yes, I can walk my dog at 11 p.m. if that's your tradition and routine. And for restaurants that close their front door at 10, doesn't mean that the back door to do takeout and delivery is closed. And so we urge people in a limited way to use restaurants in that way. And for all your restaurant operators and owners, that's certainly an opportunity to keep some amount of business going. And why are we doing this, and what are we hoping to gain? It's really to avoid further restrictions. We know, and we've seen in the past, that COVID goes from 0 to 60 miles per hour very quickly. That we're in a place today, but that can rapidly change. Maybe not statewide, maybe just in a handful of counties, but further restrictions is what we hope to avoid. But all tools are on the table. We have sort of that top shelf of the toolbox. We continue to use those tools, but on that bottom shelf, if necessary, we will explore further restrictions. But we hope today's actions, our collective coming together, our resolve to keep our protective behaviors up, will help us stem the tide and bring these surging numbers down very, very soon. Again, some reminders of why we're doing this today. Why now? Well, we want to keep the highest risk individuals safe. We know that although many people who might be out and about, even between 10 and 5, are not the most vulnerable, not our oldest Californians, not those with underlying chronic conditions. That said, we know that those who are out, who might be engaging in higher a worker who's out at night with a group of friends, outdoors even, and you contract COVID, and then you go the next day to work and it is passed on, maybe not the next day, but a day or two later, to a vulnerable resident in a congregate care facility. Exactly the situation we want to avoid. We've learned very clearly that it's not just about our own personal COVID risk, but it's about the risk that we infer on others around us because of our choices and behaviors and actions. This is, of course, to keep essential workers safe as well. Those who continue to pick our food, sell our food, prepare our food, and many other essential workers across the state, allowing them to come to work with confidence and safety, part of the reason why we do this today. We continue and haven't over the last week or two, but it's always front of my mind, the disproportionate impact of COVID. And as we see cases surge, that disproportionate impact still holds. We will see brown and Black communities across our state disproportionately impacted, more Latinos, more African Americans, more of our Asian neighbors infected because of some of those conditions of work and other situations. And we want to make sure we do all we can to support and protect those populations. And frankly, this is going to help us stop the surge faster and avoid more severe actions and restrictions, as we've talked about. And ever so important to remind you that our hospital capacity, although we did a tremendous job preparing and have those resources in place, some have been activated, many wait to be activated, but we want to make sure we protect that hospital capacity so those who need care get it and get it in a timely way and in a way that's high quality so they get all of the benefits that they can. So California, as we've reminded before, we were the first state to do a stay-at-home order. We saw its impact back in March, those difficult days adjusting to the reality of COVID, but that kept us ahead of the curve. While other states were experiencing high rates of rise and were working on flattening their curve and their transmission, we really didn't in March experience that radical rise. And just like then, today's actions will help us bring down transmission and flatten our curve, this time in a very important and urgent way. This graph, we haven't shared it in many months, but we showed you back in March that without an intervention, we see these rapid rises. And yes, it comes down, but after a really important toll on all of Californians, that without interventions, we see high case rates, high impact on our hospitals, but with interventions, with the things that we're emphasizing today, along with the many other actions that are already in place, that we can bring this curve down, we can flatten it, we can get it to a point where our healthcare system is able to do what it's intended to do, which is take care of the sick in a high quality and complete way. I wanted to remind people, because today I've already gotten questions, our own team talked about it. Why are you focused on the time period from 10 to 6? Why are we not doing what we did in March as we have significant concern around surges? Well, we've learned a lot, and we've been a state that has been guided by data, guided by science, and in that data and in that science is a great amount of learning and refining our thinking, focusing our thinking, focusing on our interventions in a way that allows us to be more targeted and do things not in all tiers, not at statewide, not for 24 hours of every single day, but in more focused ways. And what are some of those lessons? It's that masks do protect us, not only those around you, but the evidence is clear that they protect you as well. Moving things outdoors significantly reduces the risk of exposure and transmission. We've mentioned it already here. We've mentioned it for many months. Move things outside, keeping it short. Both of those things helps us reduce transmission. The whole concept of ventilation, about bringing outdoor airs indoors, even in canopied areas outdoors, making sure that we have clear and easy ventilation is an important feature to reduce transmission. We've learned that squarely, not necessarily in March and April, but really over the past couple of months. The other very important thing, no one knew this early on, that even those who do not have symptoms and look perfectly well are spreading the virus. You've heard about asymptomatic spread. You've heard about people who are pre-symptomatic spreading the virus. This is a very important feature. Unusual feature of a virus makes it harder for us to manage and track. And part of the reasons why we must take early actions. We must take actions that even if the impact is seemingly invisible to some because folks aren't sick who they're around, this fact is a very critical one that pushes us to take these actions now. And then importantly, and this has really been an important guide to me and our team here, clarifying that roughly 12% of today's cases will be hospitalized in the next 2 to 3 weeks. Since early July, we've been tracking this, and although in some parts of the states it's as low as 6 or 7%, other parts it's closer to 15 to 20%. On average, 12% of our cases will be hospitalized in 2 to 3 weeks. What does that tell you? It helps you plan based on what you're dealing with today in hospitals, today's cases, what the next 2 to 3 weeks looks like. And that helps us make decisions now so we can avoid some of those big surges in the hospital beds and the potential for not having the capacity that we've depended on to date. So again, it's always important to emphasize what we can do to make a difference, to keep our schools open, to keep that economy operating as much as possible, and our healthcare system functioning. Talked about wearing that mask, wearing your mask, not just when it seems convenient or when it seems like you're around people you don't know, but as much as possible. We've updated our mask guidance, and we will update it again as we continue to evolve with the science and see opportunities to support additional masking across our state. Keeping your distance, spreading things out when you can, using the entirety of your backyard for a gathering, using multiple rooms when you're with someone else indoors, and spreading things out, I think, is really key to helping us reduce transmission. We've talked about the importance of circulation, keeping windows and doors open so outside air can come in, and frequently is important. Keeping things short no matter where you're together with others, keeping it small. We've talked about our California standard that no more than 3 households. This includes your own household, so it's not 3 others, it's yourself and 2 others. Important. And now today, underlined here, bolded here, gatherings shouldn't occur between 10 p.m. and 5 a.m. We know that's hard to imagine how to enforce. Some of you may say, well, how am I ever going to be known if I'm doing that at home? We've depended on a partnership with all of you. This is about coming together. This is about us deciding to do some things that sure it's an inconvenience, sure we may not want to for a short period of time, so we can get this under control and hopefully bring rates down to a place where counties don't just stay in purple, move to red, orange, and yellow down the road. And it's always important to end these actions with an eye towards protecting older Californians and those at risk. I'll take this opportunity to remind you that even though only about 10% of California's cases are in individuals over the age of 65, 75% of our deaths, that worst outcome that we want to prevent at all costs, is experienced in that age category. So no, I'm not going to give this presentation again in Spanish. I'm going to invite my friend and colleague, Dr. Gil Chavez, to share some of the same message here in Spanish. And then when he's done, come back to you, wrap it up, and take as many questions as we can from reporters. So thank you, and Dr. Chavez.
Muchas gracias, Dr. Gali, por siempre darnos la oportunidad de comunicar estos mensajes importantes con la comunidad latina. El día de hoy quería yo comenzar mi presentación con una revisión muy breve de lo que es y qué se considera como alto riesgo para una infección del COVID-19. Porque a final de cuentas, todas nuestras acciones deben estar dirigidas a reducir ese riesgo. Entre mejor sepamos cuáles son actividades de alto riesgo que hay que prevenir, lo mejor que estaremos. En primero y muy importantemente, las actividades en las que es difícil usar la mascarilla todo el tiempo se consideran actividades de alto riesgo y las debemos de limitar. Por ejemplo, comer y beber cuando estemos en un lugar público frente a otras personas conlleva mucho riesgo. Entonces, removernos la mascarilla brevemente y ponerlas otra vez muy rápidamente. Actividades en que se reúne con personas que no ha visto recientemente, por ejemplo, personas fuera de su hogar, son actividades de mucho riesgo. Actividades en las que es difícil mantener la distancia, cuando vamos a estar muy congregados, muy encimados, todo eso conlleva mucho riesgo. Actividades que son de mayor duración, si voy a estar fuera de casa, voy a estar en un lugar donde hay mucha gente y la exposición, la duración de esa actividad es muy larga, eso aumenta mucho el riesgo. Y por último, actividades que no permiten que circule suficientemente el aire fresco. Entre mejor estemos expuestos a la ventilación, al aire fresco, mayor vamos a disminuir el riesgo de infección. Entre más estemos en lugares encerrados, en lugares donde no hay circulación del aire, vamos a tener un riesgo más elevado. Perdón. Muy bien. Ahora, siempre que pregunta la gente, me ha preguntado mi madre, me pregunta la familia, ¿qué es lo que da el riesgo de infección y cómo podemos prevenirlo? Hemos pensado en una fórmula matemática que es muy fácil de explicar, en que tienes por un lado lo que es el riesgo, la probabilidad de exposición y por otro el nivel de protección. Entonces, entre mayor tú tienes una probabilidad de exposición alta y lo multiplicas por un periodo de exposición muy larga, eso aumenta muchísimo el riesgo del COVID-19. Por otro lado, si tú vas a tener protección como es la mascarilla y como es mantener la distancia, eso te disminuye mucho el riesgo. Entonces, esto es un balance entre actividades que aumentan el riesgo y los niveles de protección. Por eso es muy importante que nos tratemos de minimizar las actividades de arriba, las que aumentan la exposición, y maximizar las actividades de abajo que nos aumentan el nivel de protección. Ahora,
Okay, so we've been listening to the latest press conference with Dr. Mark Galley. He talked about the surge in cases and hospitalizations. He did try to put the numbers in perspective for us, and he also talked about in more detail the limited stay-at-home order for the purple tier counties. That stay-at-home order, or curfew if you will, starts at 10 o'clock at night, goes until 5 o'clock in the morning, and it starts this Saturday night, November 21st, and will run until December 21st. And of course, we'll have much more on this, and we'll have a reaction coming up on News Channel 3 starting at 5 o'clock and again at 6. We'll see you then.
News updates on air and on all your devices.